Back to Ari in Houston, KTRH country. We didn't forget you, Doctor. Let's finish up, though. Tell us about this panel one more time.
Okay, it's called the U.S. Preventative Services Task Force, and it determines what is and isn't preventative health services, and Obamacare references it as to what it's going to apply and pay for or not pay for. And this panel, for example, of not really, they're physicians, but they're non-experts in the field, concluded that PSA testing for prostate cancer is actually harmful, even though only half as many people die every year from prostate cancer now, which is 28,000 every year, as opposed to when I went into practice 15 years ago. Which
How can it possibly be harmful?
Well, because there's complications to treatment and diagnosis. So they decide, it's a math equation. It's cheaper to let patients die than to treat their cancer.
It's unbelievable because, about 1 in 10 men get prostate cancer, don't they?
Correct.
And if you have prostate cancer in your family, one in 4, I think I read somewhere.
Right, and the same panel made the recommendations that breast cancer screening and mammograms should not be done under age 50 or over.
I remember this. It sounds like they're part of the British healthcare system.
Right, but Obamacare references this panel, so this is the secondary death panel of Obamacare. So this panel's recommendations have not been implemented yet because Kathleen Sebelius hasn't gotten around to writing all the regulations. However, the medical literature has published the recommendations. So physicians who may not really know the ins and outs of this panel are taking the recommendations. So I had a patient come to me very distraught because he wanted his PSA testing, and his doctor refused to do it because the doctor said that he read the literature, and the literature says it's a dangerous test.
Unbelievable.
So the patient came to me distraught saying, well, I really want you to do it. And I said, of course I'll do it. I mean, it's crazy not to do it. The American Urological Association, the experts, of which I'm a member, says, of course, do this test in the correct circumstance. So the deal is that this is a proactive patient. So what happens to the patient?
Well, let me slow you down. How else are you going to know if somebody has cancer or the propensity for cancer, unless they're suffering?
Well, if you don't check a temperature, you'll never find a fever.
Well, exactly. So, and then you're too far gone in many cases.
That's the point. Morphine is cheaper than radiation, surgery, etc.
Absolutely incredible.
Right. So basically what I'm trying to say is that the death panel is operational before it is implemented. So the Death Star is operational before it is complete.
And notice how they trashed Sarah Palin, and she made it clear. I mean, she was right on, wasn't she?
She was 100% on. Her only error was she said there's a death panel. There's at least 2 death panels.
Oh, gee, that's right. All right, Doctor. Well, good luck, and thank you for the information. Incredible, isn't it? And yet they wrap themselves in compassion, and they're looking out for the people and bringing down costs and being more efficient. These are vile people.